the art, but he had a Rolodex card on every one of his patients. It was filed alphabetically, and in between patients, he would write notes. Another connection detail goes back many, many years for me, but I'm going to bring it up into 2022. Omar Reed was perhaps the master of that. Many of our listeners will recognize that name, Omar Reed, where he had a Rolodex card. And actually this was in the early 80s when that was the technology, that was state of the art. But he had a Rolodex card on every one of his patients. It was filed alphabetically. And in between patients, he would write notes on the Rolodex card. He'd write their spouse's name, the kids' names, the dog's name, maybe important things that are happening in their life. Maybe their son just got accepted at a university. Those kind of notes. Maybe we know that a patient is taking care of an elderly mother. Those are the kind of notes that got put in those Rolodex cards. And Dr. Reed also invited all of his team members to add contributions to those notes. So over time, those notes became a treasure chest, an absolute treasure chest of information about the patients. Now, that was good by itself, Naren, but what he did with it is, I was going to say golden, but it's platinum. It's better than gold. What he did with it was every morning, his morning huddle was at 5:45. Dr. Reed's hours were 6 a.m. to 2 p.m. Morning huddle was at 5:45. He would come in a half hour early. He would look at the schedule and everyone he was seeing that day, and he would pull the note card and just do his homework. So let's contemporize that, bring that into 2022. Instead of a Rolodex file, we're going to use your computer. And we're going to find somewhere in your computer where you could put an electronic note card. And it should not be in your patient notes, in your clinical notes, because it will be lost in there. But find some place to put that. It could be inside your practice management software. It could be separately, however you want to do it. I don't care. Find somewhere. And all that's important is that you and your team members put notes in there. And invite your team members to add notes, because oftentimes team members will learn more about your patients than you will. Can you see that happening, Darren?
Absolutely, Gary. As you were speaking, the thought that came to my mind is, because you study successful practices, and there are two attributes of every successful business owner. One is they know what to do. And here you talked about how important connection is. And you need to know how to do it effectively. And the first point you made, Gary, is how to build connection in 60 seconds.
Yeah.
But the second thing they do, I think that's what made Dr. Omar Reed amazing, is their discipline. They do it day in and day out. They figure out how to, like a methodology to do it. Like he used note cards. You're suggesting use your computer and your practice management system. But they do it every single day. He shows up every morning.
You could set your watch by Dr. Reed. Believe me, I did, because I would join him. He would walk through the back door at 5:15 every morning. It wasn't 5:16, 5:17. He was unlocking the door, walking through the door at 5:15. Very, very disciplined in that. So now, here's the takeaway. Here's what I want you to do with those note cards. And Doctor, you're not going to like what I'm about to say. I'm not going to win a popularity contest on this. Just stick with me on it. I want you to show up 20 minutes before the morning huddle. And I want you to look at your schedule. And in those 20 minutes, I want you to read the note cards on every patient that's in your schedule, especially the hygiene patients. Because likely you haven't seen them for 6 months or longer.
Right.
That could be 3 or 4 if they're perio, but you haven't seen them likely for a while. So study the note card. And then when you walk in to do the hygiene exam, you've done your homework.